So let's bring in two masters of political messages to join us this morning. We have Ann Coulter, author of Guilty Liberal Victims and Their Assault on America, and in Washington, GMA contributor and Democratic strategist, Mr. James Carville. Thank you to you both. Mr. Carville, I will start with you. With what we see with these demonstrations, is this proof that the president has lost control of this debate, that there isn't enough for people to grab onto, there's more to be upset about than be happy about, and he's spinning out of control?
No, it's true. You got a lot of frustrated people in America, and it's manifests itself to birthers, and these people about the same lot. They've lost 2 congressional elections in a row. They lost the presidential election. The stimulus is working. Things are starting to turn around and get better. They lost the youth vote. They lost the Hispanic vote, and that's what happens. And I understand that completely. It's just a psychological phenomenon that they're frustrated, and their leaders are frustrated, and talk radio is frustrated, and the congressional leadership is frustrated, and we have to deal with this, and it's better for them to be out there screaming and yelling and doing other things. So to just accept it for what it is, march on, things are starting to work, things are starting to fall in place here.
So you see these protests solely as a function of political maneuvering against the president and not genuine protest. Let me take that point to you, Ann Coulter. Do you see these people out there as your conservative brothers and sisters just trying to make noise to distract, or are these people with real grievances?
No, I mean, you see a lot of old people, not surprisingly, that matches the polling, that old people are concerned about rationing of health care under a big government plan. There are a lot of Democrats at these protests. What I see as political maneuvering is the complaints about people showing up at town halls worried about their entire health care system being revamped rather than talking about the health care system, which does have a lot of troubling elements in it. I mean, just this weekend, Chuck Lane at the Washington Post, not a birther, almost certainly an Obama voter, said that the paid end-of-life discussions by doctors to old people is very troubling. When you have someone who's sick and you have a guy with a white coat coming in saying, well, you might want to write a living will now, that there is this implicit pressure. I mean, that's one of the big issues people are concerned with. And of course, there's also just the inherent implausibility of Obama, the Democrats telling us we're going to cover 47 million people who aren't covered. Costs will come down and we won't ration care. I mean, this is like saying eat as much chocolate cake as you want and you'll lose weight. That's our diet plan.
How about that, Jim? How about dealing with the concerns about the plan and not just dismissing the protest as politics?
Well, first of all, I can understand Ms. Coulter's frustration because her party is not doing very well. Her philosophy is frankly in the ditch, and I've seen that before, and I completely understand it. I don't know if I'm sympathetic with it. And by the way, the Washington Post, which she so elegantly cites, you should read what Steve Pearlstein said, a Pulitzer Prize-winning columnist, that the Republican mischaracterization of the president's tax plan are odious, and just went on and on. So you understand, this is about birthers, this is about death panels, this is about everything else about what's real, because they told us that the stimulus wouldn't work. Now every economist in the world is saying the stimulus is working beautifully. They told us that we didn't have to do.
But why avoid the issue on the table, though? This is about, let's just talk about health care. Is he making the case on health care?
Well, you want me to go to health care?
Please, that's what we're talking about.
We pay $7,000 per person for health care in the country, and our results don't match up in any way to that. We spent twice as much as a percentage of GDP. What I'm telling you is these protests are not about health care. They're about people being politically frustrated. They don't even know what they're talking about. Did you see the man in South Carolina that said, tell the government to get their hands off of my Medicare? Do you really think that's about health care? I mean, you really can't sit there and say, that guy is out there because he's concerned about health care. No, he's frustrated because he's losing out. This is what this really is about. That's my point here.
Respond. Frustrated person?
No, I think that is more deflection, all this frustration. You sound a little frustrated yourself, James. But I'm glad he brings up this. One of the canards for expanded health care is this idea that we're not getting results. What you always see is what life expectancy is in America. Well, that doesn't necessarily have anything to do with doctors for a couple of reasons. Just quickly, one is some countries count a birth of a child only once the child has been alive for a week. The other thing is it doesn't include, I mean, if somebody gets shot in a drug shooting or dies of a drug overdose, that has nothing to do with health care. So what you have to compare is apples to apples. If you get cancer, what is your survival rate? Ours is a lot better than any other country.
More specifics are obviously needed. Jim, I got to cut you
we
off.
can't.
because I got to
the
cut
first
you off.
time we ever had a debate that long life expectancy is a good thing.
All right.
But you know what? Maybe if you're
No, it's just not
frustrated, do that.
comparing apples to apples.
You guys keep
It's
talking
apples
into the
to
break.
oranges.
I'm going to go to the news right back. Jim, Carville, and Coulter, thank you very
Thank
much.
you.
I know it's a longer conversation. Appreciate you having it.